Hello, and welcome to the Arnold School of Public Health MPH Core Curriculum Virtual Orientation. My name is Dr. Lucy Ingram, and I am the Associate Dean of Academic Affairs and Online Education, as well as an Associate Professor in the Department of Health Promotion, Education, and Behavior, also known as HPEB. I will be your moderator for today's session. Our agenda for today is designed to provide you with an overview of the MPH curriculum, highlighting our integrated core courses with introductions from each of your instructors. You'll also hear from one of our staff members who you'll become quite familiar with along your MPH journey, Mr. Zach Jenkins. Then I'll close the session with just a few parting words of encouragement for you as our future public health leaders. Let me begin by briefly introducing you to our speakers. First, you have me, Dr. Lucy Ingram. While my faculty home is in the Department of HPEB, I come to you today in my administrative role as Associate Dean of Academic Affairs and Online Education. As part of this position, I work with your instructors and other administrators to help coordinate the MPH core curriculum and facilitate its successful implementation. Much of what I do is behind the scenes, so you won't likely see me very often. However, my email address is here in case you need to reach out to me. You'll also hear from Mr. Zach Jenkins. Zach is an associate in our Office of Workforce Development and Public Health Practice. He coordinates with each of the departments in the Arnold School to facilitate the practice experience for MPH students. You'll also hear from the instructors of each of your core courses, beginning with the instructors of your first fall semester courses, who you see pictured here, as well as your spring core course instructors. Note that PUBH 724 is Quantitative Methods 1, and PUBH 725 is Quantitative Methods 2. They are taught in consecutive semesters by the same instructional team. You'll also hear from instructors of your PUBH 735 course to be taught in the fall semester of your second year. By now, you may have heard that the Arnold School is one of over 60 accredited schools of public health in the U.S., and that we are the only accredited school of public health in South Carolina. You've also likely heard that we have an over 40-year history of turning out talented public health practitioners and researchers into the field of public health. What you may know less about is our MPH core curriculum. Our MPH programs include a 16 credit hour multidisciplinary integrated core curriculum. This curriculum is comprised of foundational courses that build upon one another within a semester and from one semester to the next. It is populated by a cohort of students who take core courses together and collaborate on assignments and projects. By design, this offers a built-in peer support system, which students have remarked has been quite helpful to them, particularly in their first semester in the program. Our curriculum mimics the real-world public health environment in which public health leaders work in teams to attack the public health challenges of today and tomorrow. The MPH core is comprised of 5 courses that are team taught by esteemed faculty from different disciplines within our school. These courses focus on quantitative methods, qualitative methods, public health systems and policy, and program planning. The core courses are designed to be taken in tandem and sequentially, as the assignments and skills being taught have been developed to build upon one another within a term and from one term to the next. Each of you will meet with your department graduate director or academic representative to discuss the order in which you will take these classes. The core courses have been developed based upon the 22 foundational competencies that you see listed here as bullet points. These competencies establish a baseline for skills that master students should be competent in upon graduation from a school of public health accredited by the Council on Education for Public Health, also known as CEF. We have 5 different departments from which a student can earn an MPH degree within the Arnold School of Public Health. These are environmental health sciences, epidemiology, health promotion, education and behavior, health services policy and management, and physical activity within the Department of Exercise Science. MPH students enrolled in any of these departments will be required to complete the core curriculum. So, here again, the core is an amazing way for students from different departments to work alongside one another to learn skills such as assessing population needs, assets, and capacities that affect communities' health, discussing the means by which structural bias, social inequities, and racism undermine health and create challenges to achieving health equity, and interpreting results of data analysis for public health research, policy, or practice. So you've heard quite a bit from me and my perspective on the integrated core. Now we invite you to hear from some Arnold School students and alumni about the benefits of an integrated core from their perspective. After you hear from our students, you'll hear from your core instructors about the core courses.
One of the great things about the Arnold School of Public Health is they're constantly trying to get our feedback and improve the quality of our degree program. And I feel with this new curriculum, they're really getting the insight from the students to see what they can do to make it more beneficial and improve the program. So I'm really excited for the changes that they're bringing in and the things that they're going to do to improve the students' overall experience.
I think that it's going to give students the opportunity to put a lot of the public health principles that we learn into practice and give them those application skills that they're going to need in the public health workforce.
I think it's great that everybody is required to take program planning, and I really thought when I was taking it that this is a class that everybody should have to take because it's so integral. Program planning, regardless of the subdiscipline that you're in, there's going to be grant applications, there's going to be programs, and so I think that's really important.
This new curriculum is going to force students to learn just about all the different fields in public health. That really, I felt, got me started, just understanding the realm of public health, knowing that you need to work with everybody in different aspects.
Here is a schematic that provides a semester by semester view of the MPH program. Please note that this is a general program timeline and that timelines may vary by student and department. For details about your time in the program, please consult with your departmental graduate director. By way of overview, you are now in your first semester in the program, designated as Fall 1, meaning your first fall term. During this term, you'll take the first two core classes, PUBH 724 and 726, as well as some departmental courses. Spring 1, or your first spring term, you'll take PUBH 725 and PUBH 730. In addition, you will take some departmental courses. Summer 1, you may choose to take departmental courses. In Fall 2, you will take the MPH core course PUBH 735 and departmental courses. In Spring 2, your final term in the program, it will culminate with your integrated learning experience, the applied practice experience, and any final departmental courses to complete the program. Please also note that this is more of a schematic indicative of full-time students. Now let's hear from your PUBH 724 and 725 instructors.
Hi, everyone. We are the instructors of Public Health 725. We all teach the face-to-face version and the online version. So welcome to our class. I am Miriam Torres. I am a clinical associate professor in the Department of Epidemiology. And I am going to be in charge of the epidemiology portion of the class. However, we want to say that we are trying really hard to integrate the concepts of epidemiology, environmental health, and biostatistics. Because we don't know exactly when one discipline ends and when the other starts. We can, epidemiologists do environmental health studies and use, obviously, biostatistics to analyze data. And environmental health scientists can use epidemiologic methods and biostatistics analysis in their research.
I'm Jim Huzzy. I'm a clinical associate professor in the same department of epidemiology and biostatistics, but I'm a biostatistician. I want to kind of echo what Miriam just said, that we're really going to try to present things in a more unified way to show you how these disciplines blend with one another. But obviously we'll have our own little areas of expertise and interest. I'll be talking to you mostly about biostatistics, which is, along with epi and environmental health, one of the key areas of public health. And I'll be talking about, gathering data, describing data, and then really the thing that I think we'll focus on, and this is where things tend to blend together, is using data to answer public health questions, like things like, does one drug really work better than another drug? Is there really evidence that people who are exposed to some sort of risk factor are more likely to get a disease than people who are not exposed? That's kind of one of the key things in epidemiology and environmental health. And we use data to answer those questions.
And I'm Jeff Scott. I'm I'm clinical professor in the Department of Environmental Health Sciences. And I'm chair of the department. I'm delighted to be teaching this course with Dr. Torres and Dr. Hussey. And the fact that the three of us are working together should indicate to you the transdisciplinary nature of the way science is moving today. It's very hard to, as Dr. Hussey already mentioned and Dr. Torres mentioned, when one discipline, epidemiology or biostatistics, ends, or and when environmental health science ends, because they all are linked together. As we approach this semester, we will be discussing selected topics of stressors, at least in my part of the class, for stressors in the environment that may pose a challenge to the health of human health and ecosystem health. We have to live in concert with our ecosystems that we reside in, and thus that balance with nature is very important in terms of maintaining a healthy environment where we live, because that leads to healthy individuals. So as we move through the class, we will present different topics on stressors. We're certainly living through a period of a major biological stressor and pandemic right now. And we will cover the gamut of topics from biological stressors to chemical stressors. We'll focus on environmental justice issues where there may be inordinate exposure to special demographic groups. And we'll talk about the importance of maintaining the environment. And that's why we want to avoid these environmental justice issues where some people get more exposed than others. So we all look forward to working together in presenting this class in a way in which we will try to stimulate your interest and then also integrate the concepts of environmental health science, epidemiology, and biostatistics.
So we'll see you soon. Thank you.
Now let's hear from your PUBH 726 instructors.
Hi, everyone. We want to welcome you to the Qualitative Methods class 726. My name's Deborah Billings, and I'm an adjunct associate professor in health promotion, education, and behavior in the Arnold School, and also affiliate faculty in the Institute for Families and Society, and that's a mouthful. So I have been working for the last 30 years or so with health systems and working on reproductive rights and health throughout the world, including here in South Carolina, since we're part of the world. And so right now, one of the projects that I'm coordinating is a project called Voices, or Voces. And we are gathering interviews from women throughout the state who use Medicaid to cover the costs of their services related to pregnancy, birthing, and postpartum. And just really getting the women's voices into decision-making and discussions around what Medicaid needs to look like is very, very exciting. And we're using qualitative methods for that research. So we're splitting this up, and I'm going to talk about one fun fact of the course. And that fun fact, I think, is pretty fun, that you're going to learn a lot more about who you are as a person and as a researcher and as a public health practitioner in this course.
Hi, I'm Carrie Draper. I'm a Senior Research Associate in Health Promotion, Education, and Behavior. I am the new instructor for the online asynchronous section of 726. The course will cover qualitative research methods for public health practice. The public health practice cycle starts with assessment, moves through the implementation of policies and programs, and then evaluates those policies and programs. We can use qualitative research methods within all phases of the public health cycle to inform our assessment, implementation, and evaluation. So we really look forward to working with you on all of those different aspects. My background is in human development and social work, and I have been working out of the Arnold School of Public Health for over 11 years now, where I focus on exploring and informing food equity within programs and policies at both a state level and some national policies of how they're implemented in South Carolina and in local communities. Within that work, I've routinely used qualitative methods, especially in-depth interviews and focus groups. Sometimes I have used community participatory approaches like photo voice, and I'm excited to soon be exploring a new for me qualitative method called journey mapping, which I'll be using as a part of a team to understand patient experiences in order to inform quality improvement of produce prescription programs around the state. So those are some of the experiences that I will be bringing into the course this semester. So I greatly look forward to meeting you all soon and learning and working alongside all of you.
Hi, I'm Nick Youngener. I'm a research assistant professor in the Health Promotion, Education, and Behavior Department here at the Arnold School. I am one of the co-instructors for the synchronous online section of the class with Dr. Billings, and I've been doing research around food and food assistance programs for a while now. My background is in culinary arts and anthropology, and so I bring those to my public health work in thinking about why people eat what they eat, whether they're able to eat what they want to eat in ways they want to eat it. And I also work as a program evaluator for a food assistance program. And so most of that research is qualitative. And I bring, from the anthropology in particular, I bring that qualitative perspective. And so we'll learn about how to do qualitative work in a public health context here, as Dr. Jones just mentioned. And so some of the ways we'll get into that is with a few different methods, one being observation. So how to be in a space and use all of your senses to gain information about how people move within spaces, you know, how they operate within different spaces. And then we'll be doing qualitative, what we call in-depth interviews, to get their perspective on their lives and on how they might think about the spaces maybe you observe them in and things like that, to really get a sense to learn how to ask questions, to let people tell their own stories, and then work with that data to arrive at hopefully a new understanding of well, like Dr. Billings said, of yourself, but also of people's experiences. I'm excited to get to know each of you, and thanks.
Now let's hear from your PUBH 730 instructors.
Hello, I'm Kelly Kennison. I'm a clinical faculty member in Health Services Policy and Management, and one of the 4 instructors for PUBH 730. And that PUBH 730 is a class on public health systems, policy, and leadership that all the MPH students take in the spring.
Okay, I'm Janet Place, and I'm the Director of Public Health Practice and Workforce Development for the school. And what I bring is I have worked many, many years with governmental public health and in community engagement, and absolutely passionate about the field. This class, we point out, is a survey class. I mean, there's a lot. You can tell by the title that we can never remember that it's covers a lot of stuff: systems, policy, and leadership. It's a survey course, so we're going to touch upon a lot of different things in a short period of time. And so we hope that rather than confuse you, that will just wet your whistle for some other courses and delving more deeply into the content in other ways.
Hi, I'm Jennifer O'Neill. I am clinical faculty in the Department of Exercise Science. And my focus for this course is touching on how systems and policy influence both the built environment and how the built environment can influence physical activity levels of populations. And then what are ways that we can change the built environment and policies to create a more active population.
Good morning, good afternoon, depending upon where you are. My name is Dwayne Porter, and I'm actually on a joint appointment between the Department of Environmental Health Sciences in the Arnold School of Public Health and the Belle W. Baruch Institute for Marine and Coastal Sciences. And I had the privilege of working with these three amazing colleagues to try to bring the environmental health perspective into this course. And one of the, albeit mid-semester, but culminating events that is a focal point of this course is to bring our students out of the classroom, either the real classroom or the virtual classroom, and bring them into a part of the living history of South Carolina and the Southeast, and that is Hob called Barony. And we have a 2 or 3 day field trip where we had the opportunity to take all of the concepts, the issues of policy, physical activity, the environment, and bring it into a real world setting using the coastal port of Georgetown, South Carolina, and the amazing gem of Hob called Barony as the focal points, so that we have the opportunity to take what we've learned from the classrooms and see how it applies in a real world setting. And knock on wood, we were going to be in a great position this coming spring semester to do such an event. And we're all looking forward to it. Kelly, back to you.
Thanks. As you can see, we are all very enthusiastic and love teaching this course. We've really come together as a team as we've worked to develop and teach this course. So we look forward to seeing you in the spring. Welcome, we're so glad you're here, and we can't wait to see you next semester.
Now let's hear from your PUBH 735 instructors.
Hello, I'm Jennifer Philo. I'm a new assistant professor in health promotion, education, and behavior, and I'll be teaching the online section of Public Health 735, Practical Applications of Public Health Planning. My background is in social psychology with a focus on social and interpersonal processes that impact health, and I actually completed my MPH degree online while working full-time and having a young child at home. So I understand the unique challenges of taking online courses, and I use that experience to inform my online teaching. Public Health 735 centers on using the precede-proceed model to assess the health needs of a specific population and design and plan the implementation of an intervention to address that health need. Because public health is an inherently multidisciplinary and collaborative field, you'll be working in groups throughout this process to help hone important professional skills. I want to wish all of you the best of luck in this upcoming semester, and I look forward to working with you in the spring.
Hello, everyone, and welcome to the Arnold School of Public Health. We are so excited to welcome you to the University of South Carolina. I'm Melinda Merrill, and I'm a clinical assistant professor, as well as the MHA program director in the Department of Health Services Policy and Management. I also have a research faculty appointment at the Rural and Minority Health Research Center. My areas of expertise are in public health program planning and evaluation, with a specific emphasis in rural health care delivery and access to services. I spent over a decade working in South Carolina's rural communities as a public health practitioner prior to coming to the university. I'm also a proud graduate of the Arnold School myself. Practical Applications of Public Health Planning, or PUBH 735, is the course that I teach in the in-person format for the MPH core. This course is transitioning from being taught in the spring to the fall semester, so most of you will probably have this course in your second year of fall. The course uses the pre-seed, proceed planning model to help you learn how to effectively plan public health programs. PUBH 735 builds upon the work that you complete during the first year of your MPH and helps you to apply that knowledge in a real-world application. We won't be just developing a plan, though. We'll also be using guidelines for grant writing along the way to give you some practical skills and techniques that you will need to help get your program successfully funded. You will work in teams to develop a plan and grant proposal during the semester, which will give you another taste of what it is like to do this in reality. We'll also have a number of current public health practitioners come and speak to our course about their experiences. The class is designed to help prepare you for the challenges that you're going to face once you graduate and start your journey in public health. It may seem a bit daunting at first. However, our students ultimately find this course to be very rewarding at the end. We have a lot of fun working together over the course of the semester and learning about lots of different things. So I cannot wait to have you in class and to learn from all of you. Let's go, Gamecocks.
Other MPH core requirements include the integrated learning experience, the applied practice experience, and the interprofessional experience. Now I'll turn it over to Zach to tell you a bit more about these requirements.
Hi friends, it's Zach again. Today I'm going to give a brief overview of the integrative learning experience, or ILE. The ILE represents a culminating experience where MPH students will demonstrate the synthesis of foundational and concentration-specific competencies through the development of a high-quality written product. The high-quality written products vary by department, but some examples of ILE are grant proposals, comprehensive exams, policy statements, and much, much more. The ILE is a culminating experience. Therefore, in most cases, it will take place during the student's final semester. If you have any questions about the ILE, please consult your program handbook or reach out to your graduate directors, as they would be more than happy to answer any questions you might have. The MPH practice experience is an opportunity for you to go out into the field and demonstrate the public health competencies you've learned during your program. You will work with your faculty practice experience advisor to identify a public health organization you'd like to work with and select the competencies to demonstrate during your time with the organization. You will demonstrate competency attainment using a portfolio approach in which you will develop at least 2 products that will be beneficial to both the organization and yourself. The practice experience usually takes place during your second year once you've completed your core MPH courses. Don't worry if you feel like this sounds vague right now, because more information about the practice experience will be coming your way as you progress throughout your program. If you have any questions in the meantime, please don't hesitate to reach out to me with any questions you might have. To ensure that you're getting the most out of your academic experience, the Arnold School will be asking for your feedback on the MPH core courses throughout your program. We will offer avenues for formal feedback through course evaluations and informal feedback through conversations and focus groups. Although there will be plenty of opportunities to voice your concerns, please remember that the best way to provide feedback is by interacting directly with your instructors. The Arnold School is committed to your success and satisfaction, and we can't wait to hear your thoughts on what is working well and what needs some improvement. Best of luck as you venture throughout your program. I know that you're all going to have a blast. Until next time.
Regarding the interprofessional experience competency, all second year MPH students will be required to attend or view an interprofessional panel discussion hosted by the Arnold School. Following the panel, they will be required to write a paper in which they will integrate the perspective of the panelists along with their own public health training and indicate key ways in which those perspectives collectively inform a solution to a public health problem that promotes and advances population health. The public health problem will be based on a case study reviewed by the panel and provided to students in advance of the panel discussion. So, we've shared quite a bit with you as it relates to what you can expect from your integrated MPH core curriculum. In closing, I hope that you see that we have a lot in store for you here at the Arnold School of Public Health. We know that you all had a choice in how you wanted to spend the next phase of your academic career. These are certainly unprecedented times, and we are thrilled that you chose our school for your public health experience. And just in case you need a reminder or a bit of motivation as you rise to the challenge of becoming our next public health leader, here are a few parting words. If you wanted an accredited school in a state with a growing need for public health practitioners and scholars, an institution with nationally and internationally renowned faculty and alumni, and award-winning students with a passion for learning and doing public health, an institution with an impressive portfolio of community partners with whom students have ample opportunity to collaborate and work in real-world public health settings, a school with innovative programs and enthusiastic faculty conducting cutting-edge research, pedagogy, and practice, you have come to the right place. Thank you for your attention, and thank you for choosing the Arnold School of Public Health. We wish you the best of luck.